this episode of CQC Connect, the podcast from the Care Quality Commission. In May, CQC launched our new strategy, and this is the first episode in a series where we will be exploring the ways we are starting to implement our ambitions and transform how we work. My name is Sam Wallace, Provider Engagement Lead here at the CQC, and I'm joined by two guests today who are going to talk about work we are doing to develop new assessment frameworks. I'll kick off by asking my two guests to introduce themselves. Amanda, can I start with you?
Hi, I'm Amanda Hutchinson and I'm the Head of Policy for Regulatory Change at CQC, and I'm leading some of the work around how we are updating our assessment approach.
Thanks, Amanda. And Dave, could you introduce yourself?
Hi, I'm Dave James. I'm Head of Adult Social Care Policy, and I'm leading on the part of this work which is to do with the revised assessment framework.
Great, thanks both, and thanks for joining us today. Maybe we can start by setting the scene a bit and giving some background on what our assessment frameworks are and where they currently sit in our regulatory model. Amanda, can I start with you on that?
Yeah, sure. So the assessment framework is basically the framework that we use for making judgments about the quality of care, and they sit at the centre of our ratings approach. They set out what good care looks like and what we are looking for in our assessments. So what does it look like to be a good provider of care? What does it look like to be an outstanding provider of care? And I think a lot of people will be familiar with the current framework and the framework that we have of 5 key questions, key lines of inquiries, prompts, and the ratings characteristics that sit beneath those. What we're doing at the moment is looking at how we need to update and revise that framework in the light of our recent strategy, and also knowing from the experiences of 5 or 6 years of working with the assessment frameworks that we have, that there are things that we can do to improve how they're set out, the content. The current thinking at the moment is that we're not going to change the 5 key questions. So is it safe? Is it effective? Is it caring? Is it responsive? Is care well led? But we are looking at the structure beneath that and starting to think about how we can make it clearer, more accessible, and make sure the content is up to date and relevant and understandable to everyone who uses the framework.
Great, thanks, Amanda. That's really helpful. Dave, could I come to you next and maybe talk a bit more about why we're exploring changes to the assessment framework, and maybe talk a bit about what we think is maybe not currently quite right about them, and maybe talk a bit more about some of the ambitions for the new framework.
Certainly. So as Amanda said, we've had these frameworks now since first introducing them back in 2015, and have learnt a lot about what works and what perhaps needs attention. We were due to do a relatively small refresh just before COVID. Actually, we'd done some work, we'd done some engagement around that, and we were looking at making some small scale changes, and then the pandemic happened, so that obviously put paid to that. So there's part of what we're looking to do now really is I guess a kind of an overdue look at some of the content that Amanda's mentioned, and actually taking the opportunity to look at the structure as well. In terms of the content, I should say we have 2 frameworks at the moment. We have one for health and one for social care. We used to have 11, I think it was. We reduced those back in 2017. There's a lot of repetition within both frameworks. They are quite long. For instance, we describe our ratings characteristics, which describe the different kind of levels of rating for each under each key question, span to some 70 pages, and we wanted to explore whether or not we could reduce that amount of information. Within each key question and also across key questions, the same topics can crop up. We wanted to see, is it possible to rationalize that structure? Can we actually have topics which sit under a specific key question rather than different aspects appearing in different places? And in terms of the the key lines of inquiry and the prompts across the two frameworks, we've got 335 of those, and again, that's quite an eye-watering number. So we just wanted to take this opportunity to think about whether that's right, whether that's necessary, whether that helps not just us to do our work, but actually to help providers to identify what works within their service and what can be improved, and also our partners and other stakeholders as well, whether it really meets everybody's needs. So there's that part of it, which is we know we need to do a bit more here. We know it's time to look again, and as Amanda said, that's also partly about what topics are now needed that perhaps weren't there before. Where do we need to raise the bar in certain areas? But our strategy signals some quite significant changes, and that's the other side of this, really, is getting us onto the right footing for the coming years in terms of how we embrace data more effectively and drive decision making and drive improvements using information, and also how we increasingly look across different providers, across areas, pull together what we know nationally much more readily than we currently can, and of course our future roles in both local authority and integrated care systems points to the need to think again about how we describe good quality. How can we do that in a way which could potentially be applied regardless of the lens which we're taking, regardless of whether we're talking about provider regulation, a small service, a large NHS trust, a local authority, an integrated care system, or some other kind of way of looking at quality. So it's quite a long list of things we want to do. We want to fix the problems and explore whether we can move, at least in some parts of the framework, to a single framework and a single definition of what we mean by high quality, safe care.
Great, thanks both. I think that really helpfully sets out where we are and some of the reasons why we're looking to make some changes here. And I know we started some early thinking on what some of these changes could be. It would be great to look at some of these areas in a bit more detail. Could we start by hearing about how I statements could be used to illustrate our key questions?
Yes, so obviously one of the four themes in our strategy is around people and communities, and we've set out the ways in which that we would like to start to reflect the experiences of people using services more centrally in our assessment processes. And the development and use of I statements has been around for a few years now. So these are a set of statements developed in co-production with people using services, which set out what good care feels like and looks like from the perspective of someone using a service. So do I feel safe? Do I feel supported? Do I feel informed and involved? So they're kind of very much framed from that perspective of someone using a service. So we're starting to look at how we could link frameworks which are already out there with our updated model. And there are two ways in which we are looking at how we could do that. So one of those is as a means of making the kind of 5 key questions, the statements that will sit underneath those, more accessible, and to help people understand what good care looks like and what they should be expecting from services. And then the other way is a framework for collecting and assessing information about people and their experiences of care. So when we're doing our assessments, we're kind of really clear what are the things about people's experiences that are most relevant at particular times and in particular settings, and how we make sure that we're collecting and getting enough evidence about that experience. So I think this is a kind of really important piece in terms of kind of how we're realising some of the aspirations in our strategy around looking at care through the eyes of people who use services.
Thanks, Amanda. That sounds really important work. And I think one of the other areas we're looking at is how quality statements can make the assessment frameworks clearer. Could you tell us a bit about that, Dave?
Certainly, yes. So in essence, quality statements are another way of of fulfilling the role that our ratings characteristics currently deliver. So really the characteristics are the most important part of our current frameworks. They describe at each level of rating, they describe what care looks like for that rating. And I suppose the most important parts of that really are how we define good and outstanding. I mentioned earlier that we take 70 pages to do that across all the different ratings, and also that there's a real mixture of some very specific information within those characteristics and more kind of general aspirations and kind of outcomes. So the idea behind quality statements is, can we extract the real kind of value from those ratings characteristics? Can we pull out the parts that are really singing about what good and outstanding looks like, and move the rest of the material to other parts of the framework, so the more detailed stuff sitting at a different level, and frame those as clear statements. And as Amanda said, a really important part of our strategy is reflecting the needs of people and communities. And we think there's more we can do to make our definition of good care much clearer. Part of that is about making it shorter, but it's also about using the right language as well. So we're exploring the best ways to frame that. And what we're keen to explore is whether we can effectively describe good using these statements, and have a system whereby we can assess how far from good a provider is performing, rather than necessarily trying to capture every potential outcome for requires improvement and for inadequate. Can we actually define good and then measure variation from that? And that would include, of course, when providers are exceeding that level. And that's a really important part of this work in particular. We've never really cracked what we mean by outstanding, and I think it's a very difficult thing to do. Personally, I don't expect we'll ever nail that down, and I don't actually think we probably should. I think we're talking about what are the principles, what kind of thing is it that we would expect to see in an outstanding service. So we really want to come out and engage with people on that and get their thoughts. But yeah, a big part of quality statements is something shorter, more compelling, something that really speaks to everybody very clearly, and that we pitch at good, and that we're able then to measure what it looks like to exceed or to perhaps fall below that level.
Great, thanks, Dave. And I think another interesting area we're looking at is around the evidence we would use to make judgments. So Amanda, could you tell us a bit about what we're looking at in terms of evidence categories and routes to evidence?
Yeah, so one of the things that we also want to do is to make our assessment process more transparent and consistent. And we want to look at whether it's possible to be really clear about what pieces of evidence are needed in order to make a ratings judgment against a quality statement in a particular setting. And we think it's possible to categorise the types of evidence that we use and the type of questions that we normally ask against that evidence. So thinking in general terms, there are probably six types of evidence that we normally look for. Evidence of people's experience of care, evidence from feedback from staff, evidence from feedback from partners and stakeholders. There are the observations of care that we do, so care and the care environment, information that we gather around processes, procedures and policies, and then also the information that we have about the outcomes of care. And what we're looking at is how we can kind of take those categories of evidence and really be much clearer about the evidence that we would look for, the particular pieces of evidence and the routes to gathering that evidence, and that will really help us to focus the information that we're looking for in order to make our judgments, and also the kind of focus of our activity, the focus of our on-site activity. So this is very much in the the strategy talks about smarter regulation, and we see this as a really kind of important part of that we're able to kind of give that clarity around what we're looking for and what are the really key things that we need to know in order to make our judgments.
Thanks, Amanda. And I guess building on that and some of the other areas we're looking at, we also recognise that we do regulate a lot of quite varied providers in varied circumstances. So Dave, is there anything we can say about some of the sector and context specific work we're doing around evidence and quality indicators?
Absolutely, yeah. So, I mean, following on from what Amanda's saying there, really, the broad approach we're taking is to look at can we articulate what good looks like and then work back from there. Whereas at the moment, what we do is we have those closes and prompts. I've mentioned those key lines of inquiry, and there are, as I say, over 300 of them. And we effectively start there and then kind of work our way into an assessment and a judgment. Because that's our starting point, that is where we inevitably have to hang a lot of specific information and a lot of a description of what it is we want to look at. So, for instance, a key line of inquiry would maybe ask what do systems and processes tell us about how the provider delivers safe care in terms of safeguarding, rather than perhaps a more generic question falling off a quality ambition around safeguarding. What that then does with those two nice simple categories of quality statements followed by the routes to evidence, these kind of generic questions that fall under 6 categories, is it leaves us with the specifics, as you say, Sam. We absolutely do not want to lose that. We need to understand at a detailed and a granular level what evidence we would expect to see and what we would look at in making an assessment. And we know that would vary greatly from a learning disability residential service to a dentist, to an NHS trust, to, of course, a local authority or an integrated care system. So if you picture a kind of a hierarchical pyramid with the 5 key questions at the top and these other layers that we've described, so the quality statements and routes to evidence, then at the bottom of that is the largest part of that pyramid, which is the specific set of evidence and what we know we need to look at and to assess. And that will all be continually kept alive by making sure we align this structure to best practice standards and guidance, and that helps everybody have clarity on why we look at what we do and under what circumstances we will seek individual pieces of information.
So we've heard a fair bit there about some of our early thinking. Amanda, it would be great to hear next about how we'll be taking this work forward over the next few months.
So the work at the moment has focused on kind of thinking through what that high level policy framework might look like, and very much the focus of attention for the next few weeks and months is increasingly to engage on that, to test out the ideas, to start to test and pilot some of the concepts that we've talked through. And this is really important, both externally and internally as well, because obviously there are a lot of kind of systems that we need to build and test within CQC as well. But absolutely about coming out, sharing this, talking through, and understanding people's feedback on what we've set out here.
Thanks, Amanda. That sounds really interesting. Dave, is there anything else you'd like to add before we finish?
Thanks, Sam. Yeah, I think just to make the point really that in this early thinking, we've been really careful to ensure that we are safeguarding the continuity with our current approach. We do need to be ambitious to deliver our strategy, but at the same time, we need to build on the baseline that we've got in terms of our ratings across the sectors. And really importantly for providers, we need to make sure that we're not disruptive here. That we need to bring providers on this journey with us, and we need to see how what we're moving to actually relates back to what we've been doing since 2015, since the 5 key questions came in. So our hope is that is clear when we start to have these conversations and start to share our thoughts.
Thanks both. That does sound like some really interesting work taking place over the next few months. If you'd like to get involved in helping shape this work, then visit our digital engagement platform. You can find a link to that in the episode description. And on there, you'll find ongoing opportunities to feedback and future updates on this work. For more information on how we're implementing our strategy, look out for blogs on our Medium page and videos on our YouTube channel. Thanks to Amanda and Dave for joining us today, and thanks for listening. Look out for more podcast episodes coming soon.